I'm not sure what I expected the first time that I used the Aura system. I think that I expected that it would confirm what I had already planned. What I didn't appreciate was the many little ways that it would help to improve my surgery and make me a more confident surgeon by helping me consistently achieve this result that I've been looking for my patients. Hi, I'm Dr. Brett Fisher. I'm Medical Director of the Eye Center of North Florida in Panama City, Florida. And confidence in using this technology really starts at the very beginning, where the patient is seen by our clinic staff and they have anxiety about the procedure perhaps, or uncertainty about what their outcome might be. And the staff really has confidence in knowing that the equipment that we use, especially the intraoperative aberrometry, will let us achieve the outcome that we're looking for the patient. And then we flow forward into the operating room, where still that confidence goes to every member of my staff when they know that we're going to get the job done right and get the lens implant the patient wants and get an accurate result. You're welcome. You did great.
Stare straight ahead there for me, and then just try to open as wide as you can.
Integrating the Aura technology in our practice was actually very easy, and as we added this into our practice, this new process, it helped us do a better job on getting a more accurate result. And then over time, the next learning curve is really about learning to judge the data and knowing that you're getting good information when you make a measurement on a patient. And so that's something I still do even 5 years later. So it's a tool, and it's a tool that gives me confidence. It's one that I think anyone can use and use well. With Verify Link, I think we finally added the missing piece, which is to really get Aura and Varian together in a way that makes sense. And by that I mean that now we have the strengths of the image guidance added to the intraoperative aberrometry in a way that it just flows very smoothly, lets me go through a case in a very systematic way, very uninterrupted. The flow is excellent, and it just makes sense. So it's a very intuitive system, and it really is very powerful. And I like that the strengths now of both systems really have been brought together in a way that works for the surgeon, works for the patient, and works for the staff. So we did about 8 cases today with the new Verify Link system, and they were great cases, very interesting, and I think the points they demonstrate about the power of the technology. All right, so we're doing registration, the first step for the image guidance. I'm now comparing the image we took prior to surgery to the image that was just obtained, and they match perfectly. So we'll go ahead and confirm that. Confirm. In one case, we had this monofocal lens implant, and we had measured the astigmatism preoperatively and felt like the patient did not need astigmatism correction beyond what we would see from the surgery itself. I'll open my main incision here. Again, it's being nicely demonstrated for me. The overlay of the capsule rhexis that's already been created, but again, the image guidance shows us it's right where it should be. And if there were any questions about the edges, I could see it well delineated with the image guidance. This one, of course, is nice and free floating. Everything looks real good there. But then when we measured, and we measured primarily to verify the spherical power of the lens, we coincidentally found that the patient had more astigmatism than we had measured preoperatively. It's nice that we have the option of me making the measurement or my technician. I like doing it myself most of the time because I have the control and know that my conditions are perfect. So again, a fair amount of astigmatism, similar axis. So let's use the first measurement. Earlier ones tend to be better. Both are very close. So let's view as eyewall power. And so we'll use a 20 diopter lens. And a T3 is predicted to leave us with no residual astigmatism, so we'll go with the T3. Good. This is really the only device that I think can give us an accurate reading of total corneal astigmatism, including the contribution of the posterior surface. And sometimes, when you get into surgery, you find that what you were expecting isn't necessarily what's there. And this was a good example of that. You can see the digital marker, which allows me to align the lens. In this case, This patient wouldn't even have been marked preoperatively, so I would have had to stop in the middle of the case and put ink marks on according to the aura measurement, but now I can just flow along seamlessly with confidence with the image guidance. So this is really a huge plus for this particular case, obviously. This one we have just a hair more residual astigmatism than we want. So we're going to adjust the lens slightly. So with the live streaming data, I can see that I still need to rotate this lens a bit more. Again, everything's in my ocular that I need. I'm not having to look out at the machine. I'm not having to mess with anything. I'm just doing this all in real time. Good, look right at that light. Good. So down to about a quarter diopter residual astigmatism, so that's exactly where we want to be. That's excellent. Good. So now we're going to align the axis of the lens to this digital marker. So you can, with my foot pedal, I'm doing a 1 degree per swipe move, and you can see now it's exactly aligned. So this digital marker will now keep my place, if you will, while I clean up and conclude the rest of the case. And if the lens rotates, which it should and probably will, then we'll just put it back where it was. Good, perfect. And again, real advantage of having that display so that we can do these measurements. Good. Okay, we're all finished. Everything went perfectly. So if I had gotten the spherical power of this lens implant right, but I hadn't known that there was a full diopter of astigmatism, the patient would have come out of surgery probably somewhat disappointed that they weren't seeing clearly and not understanding why. Good morning.
Good morning.
All right, well, how'd you do last night?
Good.
Good. So this saved us from having a dissatisfied patient, possibly a reoperation or some kind of enhancement procedure down the road. All right, good. Since using the Aura system, especially with Analyzer, we actually have been able to track our results and our outcomes. And I've been very, very excited over time to see how well we're doing, how well our patients are doing, how we achieve the goals. I can share with my patients my exact statistics, you know, what my outcomes are, what they're likely to be for them. And again, with confidence, I can tell them, I believe I can achieve this result for you. When I was a resident, I can remember when I first started doing cataract surgery, I think, wow, I did a great phaco. That was just so much fun. It was wonderful. And now when I leave surgery, with the advent of you know, this incredible technology, intraoperative aberrometry, the image guidance, the link system, when I leave, I leave with this feeling that, wow, I'm doing the most incredibly accurate surgery of my life. And it's just an amazing feeling. And I go home, I tell my wife, I'm doing the most accurate surgery I think I've ever done. And it's really cool, and I really enjoy that.